So now we've made it halfway through the program. You guys, I have an opportunity in a little bit just to go back to the beach. Thank you again for coming back. Well, now with our Luella Klein lectureship. As all of you know, Luella is a lifelong advocate for women, their babies, and providers who care for them. And in 2018, the GOGS Foundation actually established this lectureship to honor her incredible contributions. As all of you know, she had a remarkable career, graduating summa cum laude, not thank you, Lottie, but summa cum laude, with the University of Iowa and earned her medical degree in 1949. She made history as the first female department chair at Emory School of Medicine and was a pioneer in maternal fetal medicine. And her work continues to inspire us today and is actually the reasoning for the Luella Klein lectureship. You know that she had numerous other accolades, as well as being the first female president of the American College of Obstetricians and Gynecologists, and actually the 25th president of GOGS, the Georgia OBGyn Society. And just to give you a little bit of history, I'm the 74th. So between 25 and 74, just a long time that she was with us. Jeanne Conry, that we have today, is actually a well-deserved recipient for this lectureship. Many of you know her as the 64th president of ACOG, and she is currently the president of the Environmental Health Leadership Foundation and serves on the executive board of the Forum Institute. She received her PhD in biology from the University of Colorado and her medical degree as well as her residency at the University of California, Davis. Not only was she the ACOG president, but she was also the FIGO president, International Federation of Gynecology and Obstetrics, from 2021 to 2023. She has multiple leadership roles, including chairing the Women's Preventive Services Initiative, which is a national coalition dedicated to evidence-based preventive health care for women, and has also contributed to global maternal health strategies through FIGO and partnerships in maternal, newborn, and child health. She has introduced the U.S. National Maternal Health Initiative and has received several prestigious awards, including the Environmental Protection Agency Health Champion Award and the Visionary Leadership Award from the University of California. She has been recognized by the United States House of Representatives through honorary fellowships and has had multiple lectureships in other countries. So I welcome to the podium the Luella Klein lectureship for Jeanne Conry, the Preconception to Infancy, Reproductive Health and Environmental Impacts, and the Women's Preventive Services Initiative.
Thank you so much, and I'm honored to be here. When I was thinking about this lectureship, obviously coming to Georgia is an absolute delight, and seeing the leaders like Dr. Green and others here in the audience that have come through, everything you do is truly an impressive accomplishment for the state of Georgia and your impact on women's health. But as I was thinking about it, sometimes you're so old you know the history behind different things, and it was in the mid-2000s when we came up with the concept, and I'll talk about it, about environmental impacts. We went to Ralph Hale, who was the CEO of ACOG at the time, and he said, yes, that sounds like a great idea. Hal Lawrence then helped us shepherd it, but it was Dr. Luella Klein who made sure it came through her Underserved Women Committee and brought it to fruition. So when I hadn't really thought about that until last night, and then I realized that it came through that one very important committee, and as I give examples, you understand why it came through the Underserved Women's Committee. Now it's part of OB and part of GYN, but there's an evolution in anything when we're talking about women's health and how we get committee opinions passed. So let me go ahead and make sure good. In terms of conflicts of interest, I do sit on the Forum Institute. It is a nonprofit dedicated to maternal and infant health and environmental concerns. They got their history started back in many years ago with autism, specifically about the pro-vaccine approach and behavioral therapy to autism. So they're not the anti-vaxxers. They're a very strong alliance with Harvard and the work that came out of there for behavioral therapy. And I introduced them to the idea that you need to go upstream when we talk about children's health outcomes. But I do provide lectures, much like Haywood does, for Hologic when it comes to well women health care. My objectives are pretty straightforward. I will describe what preconception to infancy is. My goal is that anybody here in the audience who wants a copy of the slides, take it and promise me that you'll give this talk many more times. I want you to understand the importance of environmental toxicants because they impact every aspect of our life. I'll be focusing mostly on preconception, prenatal care, and childhood outcomes, but there's an entire perspective on fertility that is equally as important. I'm going to advocate for certification of products and certification so that we all can look at something and say, oh, it's P2I approved. And then finally, go a little bit into mass spectrometry for all of us. Preconception to infancy actually is a puzzle that we've put together that takes in well woman health care. And we're doing that great, if you think about it. We know what we need to do. It also takes in safe and respectful maternity care. And as we heard from Dr. Brown this morning, we're doing a lot there, and we know that well. I'm going to talk about the environment, because that's an area that we are not comfortable with, and yet it impacts every part of our patients' lives. And I think a lot of our patients are asking, and we don't know what to say to them. Really, if we look at this as care across the lifespan, WPSI came to fruition, it's in its 10th year, and it really is, the Women's Preventive Services Initiative is a collaborative effort amongst all providers of women's health across the United States, and I'll talk about it in depth tomorrow. But we do it well. We've got resources, checklists, a fabulous checklist of information over age. All we have to do is know we've got the information, we should be able to amplify that message. I'm here to say I'm going to amplify it. Likewise, safe and respectful maternity care. Now, this has taken a global look when the World Health Organization in 2021 for World Patient Safety Day said we need to address safe and respectful maternity care. So what did ACOG and the Royal College do? This is while I was FIGO president, we came up with a childbirth Bill of Rights. We created an ethical framework for maternity care based on safe and respectful care. The Bill of Rights is actually a wonderful document that talks about what we should be doing. Vivian Dickerson, I think, gave us the idea about a Bill of Rights many, many years ago when she was the ACOG president. But much like everything else, we've got good examples. The California Maternal Quality Care Collaborative has done a phenomenal job looking at maternal morbidity and mortality and helping drive that number down through a systematic approach to maternity care with successes. We've got the California Surgeon General, I love to say, is an OBGYN, Dr. Diana Ramos, who helps found the Interconception Care Committee in California. So she's taken this message across the state. So when you get individuals like yourselves in politically important positions, you can affect change. And then we've got the Alliance for Innovation on Maternal Health that's done a fabulous job with taking these messages and systematically saying, we can do better. We just need to amplify that message. So we've got two strong messages in the country around this. We know what we have to do. We can implement it. I'm here to talk about the environment because I think that's when we all get a little bit nervous. The environment is outdoor biology, right? We think about it outside. It's not anything that we have to do, and yet it is. You look at that fetus, and the fetus has an environment that it's exposed to. What are the exposures? What's the environment for the fetus? We know a lot about that when we talk about teratogens or when we talk about elevated glucose. So we feel pretty comfortable, but there are other exposures. And when we look historically and say, what have lives been like, we can look at disease incidences over about the last 40 years. And across the board, many of them have changed. Whether it's looking at genes, they haven't changed in just a 20 to 40 year time period. We can look at epidemics like diabetes, ADHD, autism, testicular cancer, decreased semen. All of those, we've seen changes in just a 20 to 40 year time period, much more than one would expect with genetics alone. There is a close genetic environment link that's called the exposome. So we'll never understand the etiology of diseases if we don't factor in environmental causes. If you look at just autism prevalence in the United States, we can see this strong upward curve. Some of that people will say, oh, we know how to diagnose it better. Granted, we have very clear diagnoses, but even with that, in just a short time period, we're still seeing an increase. If we look at ADHD across the spectrum, we've seen increases over a short time period. Again, more than can be explained simply through genetics. We've got studies out of Finland, Denmark, many different countries looking at the same pattern where they've got a fabulous database on birth and children's health outcomes. And if we look at testicular cancer, breast cancer, hypospadias, or decreasing sperm counts, again, it's that same time period. These are from Dr. Linda Birnbaum, who led the NIEHS for probably 15 years. She is probably one of the world's experts on environment and disease processes. If we look at diabetes and asthma, we still see some of the same patterns. Granted, there are genetic predispositions, there are socioeconomic predispositions, but there is also an environmental contribution. And if we forget the environment, then we've got an incomplete picture, and we're not giving our patients the right amount of advice that we should. This is a summary that looks at factors that impact IQ and the total number of IQ points that are lost because of different disease processes. So the first one are medical conditions, and we actually see an impact on IQ based on congenital heart disease, preterm birth, type 1 diabetes. There's another category looking at neurodevelopmental disorders like ADHD, ASDs. At the very bottom, it's environmental exposures, and it simply is looking at mercury, organophosphates, and lead. The IQ points just from that small category is more than the IQ points that we would see lost in some of the others. So it's to show that environment can impact IQ. And I would argue preterm birth has a very strong environmental component. I would argue that if you look at the neurodevelopmental disorders with pesticides, phthalates, and certainly lead, there's strong environmental. So that's even an underestimate of the contribution to environmental factors and environment. And I say we, as OBGYNs, are some of the world's experts in how environment impacts health. But we've often forgotten history. We know about thalidomide, we know Minamata and methylmercury, diethylstilbestrol in the 1970s, lead even today, and endocrine disruptors here in the 21st century. Lead we're some of the best experts on because we've seen that over time. So why should we become involved? Well, I always say we're not very good. If we don't have an answer, we kind of put our head in the sand and try not to address it because we don't feel so comfortable. So I'm here to say, as ostriches, we need to pull our heads out of the sand and be able to address it a little bit better. The most important document you can look at for women and children's health was published by the National Institute of Environmental Health Science and the EPA, the Children's Environmental Health and Disease Prevention Research Centers. These are children's centers across the United States. If you want one document as a reference, this is it. So when anybody says we don't have good data, we don't have good information, we really don't know what we're talking about, pull out this document, and it is an incredible compendium of information on the environment. And if you look at it, its summary page says Children's Health Matters. We've seen a 35% increase in childhood leukemia alone in a very short time period. 35% increase. We've seen 8.4% of children in the United States have asthma. 1 in 42 8-year-old boys has autism, and that number has actually increased from that. This was 2017. It's increased to about 1 in 35 now. So this is just one of the summary pages from that document. But if I highlight the science that's gone into this, this is 27 children's centers across the United States, $300 million worth of grants over about a 25, almost 30-year time period that's gone into producing this. So when anybody says there's no research, there are no data, there are no studies, pull this up and you will see an incredible amount of research that has gone into it, and it helps us. We don't need another task force on autism. We've got our own research that's showing what's happened, neurodevelopmental disorders. And I'm just going to give a quick summary. If you look at associations, these are some of the conclusions from this document. Childhood exposure to organophosphates is linked to increased asthma symptoms. Polycyclic aromatic hydrocarbons, which are found around the globe, impair T cell function and are linked to asthma morbidity and decreased lung function. Maternal exposure to phthalates. Phthalates, the creams we put on our face. We've got phthalates all around us. During pregnancy is associated with decreased fetal growth. If we look at organophosphates, proximity to exposure to organophosphates, either if it's sometimes in the food we're taking or it are some of our underserved populations where they're in fields that are being sprayed, but the proximity to exposure is associated with both preterm birth and shortened gestation. PBDEs, think of flame retardants that are on our sofas. Decreased birth weight. Fathers are exposed to pesticides, PAHs, and hydrocarbons at work are more likely to have children with leukemia. There's association between leukemia and exposure to tobacco smoke, pesticides, paint, organic solvents, and the PAHs. Immune system is certainly affected by some of these, particularly with PFAS impacts the immune system, and we see that then in the inability of a child to respond to a vaccine. Maternal immune dysfunction is associated to some of these conditions, and we see an association with metabolic function. Exposure to mercury, lead, arsenic, and to pesticides is associated with neurodevelopmental disorders. So think of that, because I'll get to this again later. Mercury, lead, arsenic, all associated with neurodevelopmental disorders. Phthalate, again, is seen in developmental delays, and ASD has doubled in children who are living close to who are born to a mother living close to a freeway. Endocrine disrupting chemicals like BPA, and BPA we may hear about and think they're taken off the market. They just do a regrettable substitution, put another chemical in, and they can call it BPC or BPR, BP something. It's still the same thing. You just have to redo the research all over again. It's associated with obesity and type 2 diabetes. Children that are exposed to phthalates, we're seeing early puberty, and that's certainly something that we've seen across the board with early puberty in our young children. We know that arsenic is a potential health risk, and it affects the fetal immune system. Again, BPA and PBDs are neurodevelopmental problems. Phthalates negatively impact birth outcomes. Some of the best research on phthalates has come out of the University of Georgia and the work for the PROTECT study in Puerto Rico, where they've looked at phthalates in particular and the Superfund sites in Puerto Rico. Some of the very best work on all of phthalates has come out of that, showing the impact on pregnancy outcomes. And we've seen disrupted placental development, preeclampsia with PFAS, and intrauterine growth restriction. So these are a set of conclusions from almost 30 years worth of research out of 27 centers across the United States. Incredible amount of research has gone into this. We can keep looking at other things, neurotoxic mixtures of chemicals that are extracted from the blood of pregnant women. This is a large study that came out of Germany looking at about over 600 women, and they found the analytes in their blood were cumulative. So, we'll concentrate and say, all right, somebody's got an exposure to a phthalate, somebody's got an exposure to a PBDE. They looked at these and said that these are additive mixtures. So you have many different sources that you're exposed to. Most of the research just looks at one at a time, but they're saying most of our information comes out of well-described bioassays. Only when we're measuring the blood of a woman and looking at outcomes across the spectrum do we have a better idea of what's going on. And we've got 20 years of microplastic pollution. And what have we learned here? Well, we've got microplastics that can latch onto the cell membrane of red blood cells. They're found in the feces of children who are bottle fed and in patients with irritable bowel. University of New Mexico has shown that every placenta they studied has microplastics in it. And a study that just came out 2 weeks ago said all the brain samples that they're looking at have as much as a teaspoon of plastic in the brain samples. So we haven't started studying microplastics enough other than their association with some of the chemicals that are found in them. The Lancet just did a countdown on health and plastics and pointed out how deadly they are and have the potential for being the next area that we need to be really doing research. In terms of chemicals in the environment, we've got 70 to 100,000 chemicals in global production, and many of those in underserved parts of the world, where chemicals that we've now banned in the United States are being produced around other parts of the globe. So how do we discuss the science? We can hear all of this, but how do we take it home, and what can we tell our patients? Well, first, what I had are what I call 3 aha moments. And the aha moments are things that I said, okay, this changes what I'm looking at. The first was lead and lipstick. California, we got a phone call from the state legislature back in probably 2008, 2009, and the legislature said, what's California ACOG policy on lead and lipstick? I thought, oh shoot, well, lead's bad, lipstick's good, we don't have a policy. And that's when we realized we really needed to look at that, went to Ralph Hale and then to Hal Lawrence and said, what can we do? But that was the leading step for us getting involved in the state and then across the United States in environmental topics. It was lead and lipstick. Something as innocent as that, we realized there's absolutely no research on lead and lipstick. Zero. No studies, nothing. The second was UC San Francisco, who helped partner with ACOG on all of the work. And this aha moment was, for me as a physician, I live in the clinical world. So pharmaceuticals, you have to show efficacy, you have to show safety before we ever expose humans to them. That is the standard for our pharmaceutical world. That's why environmental topics have been so hard for all of us to grasp. We live in that part of the graph. We assume everything is in that part of the graph. Most of the world is in the other. Manufactured chemicals, including every supplement, has to show evidence of harm before they're removed from the market. Say that again. You have to prove that they cause harm before they're taken off the market. Now that's a pretty hard standard to hit because they're already on the market. They're already there with a lot of other chemicals, so you have to be able to isolate that one chemical and show it's causing the harm that you see before it's ever taken off the market. We've got a ridiculously low standard for everything but pharmaceuticals. And then the segue from that is prenatal vitamins are contaminated with toxic chemicals. That was my third aha moment because I had no idea. I put prenatal vitamins right there in the pharmaceutical world. They aren't. They sit in the supplement world, and there are no standards. And I'll get into that later and develop that. Dr. Nate DiNicola is our chair for our FIGO committee on climate change and toxic environmental exposures, and is the liaison between ACOG and AAP on environmental topics. It has written several of the committee opinions I'll reference. So, what can we do? Well, we've got policy reform. And if you look at policy reform, we have changed the pharmaceutical world. So it's a high standard. Why can't we change the chemical industry? We have tried, and I can't say we've absolutely failed, but we've not gotten very far in changing the pharmaceutical world, in changing the chemical world. We go through federal, we go through state. It's very difficult to do that, but we haven't held them to the same standard. And the supplement industry is like the wild, wild west. And like I said, I'll get into that a little bit later, but there are really no restrictions unless somebody shows harm. So if we look at other areas, we've got the Collaborative on Health and the Environment, who says we need to follow a precautionary principle. If an activity raises a threat of harm to human health or the environment, precautionary measures should be taken, even if cause and effect cannot be fully established scientifically. So it says, let's be cautious. If you're going to expose a human to this, and you're not quite able to prove that it's going to cause harm, let's at least not expose a human until we can study this further. So that's been proposed. 1998 is when it was first proposed. The European Union has based their European law on that proposal. So they've got an entire brief on the precautionary principle and decision making, and they say where there are threats of serious or irreversible damage, lack of full scientific certainty shall not be used as a reason for postponing cost-effective measures to prevent environmental degradation. It's written into law. So whenever somebody says to you, well, this baby formula from Europe is safer than the United States, there's a reason they're saying that, because it's hit a higher standard than what we do here in the United States. So ACOG in 2013 issued a joint committee opinion with ASRM and ACOG. Linda Giudice was the president of ASRM. She was the chair at UC San Francisco. So we put together a very strong committee opinion that has been revised twice with more specific information, but it is a summary of all of the research about women's health underserved populations and everybody in general, but different toxic chemicals and the impact it has on health. We then went on to expand this to FIGO, the International Federation of Gynecology and Obstetrics, in 2015. And again, it was led by Linda's group from UC San Francisco, but in collaboration with those of us from ACOG. We said if ACOG can do it, FIGO can do it. And that set a standard for the entire globe so that every society around the globe now has this as a goal to follow. We were the first global opinion on women's reproductive health and exposure to environmental toxics. And we said it's the air we breathe, the water we consume, the food we eat, and the products we use. If you just use that mantra, that tells you how you can divide this and the impacts on our health. And we also said that this gets down to environmental justice because some of the poorest and underserved parts of the world are being impacted the very most, whether we're looking at parts of the United States or anywhere around the globe. We then gone on to take this and we've got toxic environmental exposures in maternal, fetal, and reproductive health. Again, trying to get this into the OBGYN's reading. Let's see. Where we've taken specific types of chemicals, shown what their effects are, and then recommendations on what we can do to minimize our effects. We've got clinical counseling on reducing exposure to toxic environmental agents. And we said that's not enough. We need to also address climate change because climate change is happening, it's impacting our patients, and it's impacting our underserved populations in a very negative way. And we think that OBGYN should have a major role here. This was released in 2021 before COP26 in Scotland. And we took ACOG's opinions and put those together. And ACOG in 2021 then put together reducing prenatal exposure to toxic environmental agents, where it was a how-to, what you need to do to see the research and what you need to do to help your patients change it. But a lot of us feel like this is more than I can handle. I don't know this alphabet soup of chemicals. I don't feel comfortable. So our goal is to simplify it and just come up with some guidance around a couple clear things that you can do and also project into the future. But all of these are in ACOG guidelines that you can follow. And it gets down to how does environment impact health. So I'm just going to give a couple specific examples here. Air pollution. When we look at air pollution, we know that a research study, again, Nate DeNicola and a team he's working with looked at 33 million births in the United States and said exacerbation of air pollution and heat exposure related to climate change may be significantly associated with risk to pregnancy outcomes, looking particularly at low birth weight and preterm birth. 9 out of 10 articles found a significant association between heat and adverse birth outcomes, and then PM 2.5 and low birth weight and preterm birth. Air pollution and racial disparities have been a significant factor here in the United States, and here they specifically looked at this related to some of the smoke exposure. Findings in all of the articles show that preterm birth, small for gestational age, low birth weight, and stillbirths related to exposure to air pollution were particularly significant among Black and Hispanic populations and than among non-Hispanic whites across the United States. Let's look at heat. Here in heat, we've got an overview of heat and pregnancy. You know, you think about it, we're mammals. And so we all went into this thinking we're mammals, we thermoregulate, there isn't any problem here. Yet the more we look at heat, and I'm from one of the hottest parts of California. It's 110 degrees at my house today. And we used to joke that, you know, the state fair would happen in July and August, and our hospital was about half a mile from the state fair, and we'd get all these women in, and we'd joke about heat and, you know, the state fair and preterm labor, and now we realize actually it wasn't a joke, it was really happening. We just hadn't had any research at the time. So everybody has said we're mammals, it shouldn't affect us, but there seems to be an inflammatory response to heat when we've got extreme heat that is correlated with preterm births, stillbirths, and low birth weights. And there's growing evidence that pregnant women are able to appropriately thermoregulate, but whether it's placental blood flow, dehydration, or this inflammatory response, those may be the triggers to preterm birth. And then we've got this other slew of chemicals, the ones that I've used, I call it the alphabet soup because it gets too much to be able to say all of those different chemicals. but there's an entire alphabet soup of chemicals that are in the products that we use on a daily basis. And just looking at something as straightforward as pesticides, we know that proximity to agricultural activity impacts health, whether it's brain development in the fetus. There are very clear MRIs that have shown that, whether it's preterm birth or low birth weight, or later on in development, autism and the ASD, the spectrum of disorders. So epidemiologic studies show a clear correlation with low birth weight, fetal death, and childhood cancers. There's a higher prevalence of cryptorchidism and hypospadias when there's extensive farming and pesticides. And I used to see this, we saw it in 2 areas in California. Salinas is a big strawberry and a big fruit-producing part of California, and our consults up in Stanford were seeing more fetal defects coming from that. And then in Sacramento area, we're seeing it from the Central Valley. So we were hearing from our referral networks about this, and then some of the research that then took place after that showed some of the prevalence in these exposures. There's a relationship between cryptorchidism and persistent pesticide concentration in maternal breast milk, again, a reflection of exposure during pregnancy. And certainly endocrine disruptors and impact on fertility, whether it's ovulatory dysfunction, some links with endometriosis, and certainly with fibroids, but we're seeing endocrine disruptors impacting both sperm count, sperm function, and fertility. There is a group, if you want to just look for one group, Project Tender is a group of epidemiologists, pediatricians, 2 OBGYNs, scientists that look at neurodevelopmental disorders and the risks from different types of chemicals. And they've got a fabulous website that you can look at and see the research. They're very politically active, so whenever the research is done, then they have tried to change laws or at least educate people about some of the findings. This is a lot to look at, but what are the effects of organophosphate exposures on children's development is one of the pages that they've got. We put together a problem with PFAS. These are polyfluoroalkyl substances that are now, they're called forever substances because they don't disappear, they don't break down. They're associated with testicular cancer, kidney cancer, immune response in children, some studies suggesting association with preeclampsia. They're called forever chemicals because they don't break down, so you'll see people calling it that instead. And they are found in food products because of the food wrapping around them. They're found in spray from fire departments or different types of aerospace engineering. So there are a lot of contamination. Slick surfaces, if you think of that. You can inhale it from dust, you can get it from water exposure. It's really across the United States, but certain concentrations in areas where there have been high levels of exposure. We've certainly heard, well, Michigan for sure, Connecticut, and other areas. What are some of the effects? Again, this is just a list: thyroid function, immune response, metabolic function, developmental disorders, and colitis. And how do you limit your exposure? It can be very difficult. Don't get microwave popcorn. Just skip that one. The water, if you know your water source or are able to have a water filtration, discard old stain-resistant carpeting, look for those kind of things. Teflon pans was my first thing that I got rid of, and that was painful, but I got rid of all the slicks, those kind of non-stick surfaces. FIGO called in 2021, called for a ban on PFAS because of the impact on women's health. And we called for a precautionary principle to follow that. And then I said I'd get into the prenatal vitamin contamination because this was truly my aha moment. I had no idea. There are a lot of publications on the supplement industry, and I know that. You always hear about supplements and being cautious. I just never put the prenatal vitamins I was prescribing for all my patients into that category. So they pose a threat. The Dietary Supplement Health and Education Act specifies that dietary supplement and products must be manufactured free of contamination. But they are sold in the United States without providing any proof that they are free of contamination. And the quality is determined by the FDA, but the FDA doesn't do anything with that unless somebody brings a concern to them and they study it. So it's up to the FDA to take it off the market, but they pretty much don't unless some specific complaint has come together. So what's the solution? This author called it the Wild, Wild West. He said it's got to take a complete change in the approach that we have towards any of these supplements, requiring post-production assays to prove that they are actually safe. This is a study, I think, for most OBGYNs that was kind of the eye-opener. It's a study out of Canada. Dr. Schwalfenberg looked at, I think it was, 26 prenatal vitamins tested. 26 of them were tested, and every one of them contained a toxic heavy metal. We're talking lead, mercury, cadmium, and arsenic. Now, he doesn't name what the vitamin companies are. They can't do that, but they did take 26. And there were some vitamins that did not even have folic acid in them when they did their assays. Every time, I know, and then every time this has been replicated, the results are exactly the same. Maybe a little different type of assay. Lead Safe Mama did a study on lead in a number of different types of vitamins and found lead in them. At ACOG, I talked with the different vitamin companies and said, do you do post-production testing? Not a one of them does. That's the only way you know if they're clean. Herbal and dietary supplements, this was an article out of Lancet that said it's unregulated hepatotoxicity. This was a study on prenatal multivitamins. Again, Journal of Nutrition showed that they were contaminated. 32 non-prescription, 15 prescription products, arsenic, lead, and cadmium above USP purity limits. Now, USP and NSF do provide standards, okay? So they do have a testing standard. So if somebody has said they meet USP or NSF, it means that they're a standard. Now, I would argue, and I will, that that's not the standard we want for a prenatal vitamin, because we don't want lead and mercury in our prenatal vitamins, and those allow some. We want a de minimis standard, meaning 0, but they even were exceeding USP levels. Labels are misleading with the potential to harm pregnant persons, was their conclusion. And then looking at heavy metals and phthalate contamination, prenatal vitamins, and folic acid. So each one of these said there were heavy metals found in each of these supplements. So then you go to the Government Accounting Office. They said, this can't be true. We're going to study this ourselves. So this came out in December 2023, and they essentially called it the Wild, Wild West. They said the FDA regulates neither type of, whether it's an over-the-counter or prescription, neither of these is required to be evaluated for effectiveness or safety pre-market. That's not a requirement for any vitamin, prenatal vitamin that we're using. The limited reach of FDA's oversight over dietary supplements, including prenatal, this is their actual conclusion, prenatal supplements could lead to unfavorable health outcomes for vulnerable populations, that is, pregnant individuals. You don't have to prove that you've got folic acid in your vitamin. You say you've got it, but nobody is doing post-production testing. So they said key nutrients differ from the product label. You can go through the site and it shows the different fast facts. And they had 12 prenatal supplements that they tested. And again, lead, cadmium, mercury. Now, one of the things that I'm very proud about, FIGO came out with a statement in 2023 and said, this is not acceptable. What is the one thing that we're all prescribing around the world for our patients? Take a prenatal vitamin, preconception through pregnancy. And we said, given the fact that there is no standard here, we believe that we should have a list of chemicals. We had a global team put together what chemicals should never be found in these products. And we published it and said we believe all should be a standard that should be met. So all vitamins should be certified with, we say P2I because that's a FIGO statement. There's a group that came out of Australia that said before the beginning, environmental exposures and reproductive outcomes have said, given the magnitude of the field, we should be knowing more, and preconception visit provides the opportunity to counsel women. Can we improve our guidance? Absolutely. Is it possible to measure toxicants in the blood and the urine? Yes. Is it possible to buy a home PFAS test? Yes, they're really expensive, but you can get a test. Is it possible to measure toxicants in consumer products and determine if they're contaminants? Yes. We can use mass spectrometry, and Agilent Labs has set up almost every university program in the United States with mass spectrometry to be able to do this. FIGO's Committee on Climate Change and Toxic Environmental Exposures has taken this to heart and said we can provide guidance here and provide some solutions. First, we can use biomarkers for clinical care. The biomarkers are used now in clinical practice, whether we're talking about characteristics that we know in an individual, or we do it in our emergency room evaluations. We're very comfortable using biomarkers when we're in the intensive care unit, when we're in the emergency room and somebody has a lactic acid, when we're studying a cardiac patient and we look at cardiac enzymes. Will biomarkers guide us in our change? How much is enough? We don't know, but we do know that we can use it to measure certain areas, and they're used frequently. Can we measure toxicants? Yes, we can use exactly the NIEHS levels and examples to measure toxicants and use that to guide patients. This article out of Australia also said, let's unveil the audience, the elephant in the room. We've got a bunch of people around the globe who are very well versed in apps and in science and in understanding. Why can't we take that we know chemicals in the air, in the soil, and in our products that we're using, they contribute to chronic medical diseases. Can we take that information and give our patients feedback? We've got 40,000 smartphone health applications. We've got all of these sensors that we can use. We've got genomic profiling. Why can't we have biomarker profiling that help give information? So adopting widespread information science can allow clinicians the ability to give guidance. And in fact, you can get phthalate measurements down to such a specific level. You can say, did the phthalate come from an IV tubing or can it come from the facial product that somebody is using? So I would say tomorrow's health professionals here today, clinicians have a unique and important role. Instead of telling women that you're helpless because we don't have a robust regulatory environment, you can empower women to bring about changes. Almost done. The challenges are that we've got large population biomonitoring that we have to do. It gets very complex, but we do have the guidance from the NIEHS on which chemicals we should look at. We've got the guidance from FIGO on which chemicals are probably the most harmful for maternal and child health. And we've got new ways that we're able to actually measure these types of health assessments. We can do, historically, it's been very costly to do biomarker studies, and we've used a zip code instead to try and infer what an exposure is. Now we've got the biomarker studies down to, they're less than $100 to do a whole panel of chemicals, or about $120 to do an entire panel and give patients feedback. When we actually measure and provide feedback to patients, it provides guidance for them so that we can measure, bring about change, and remeasure and give them better guidance. I call it empowering with knowledge and tools. We can empower women to make decisions that follow a P2I approach. We already know well women care. We know optimum prenatal and preconception and pregnancy outcomes. But with these environmental tools, we're able to provide a better guidance for women that actually empowers them rather than making them feel like they're subject to the whims of lack of any regulatory environment. When we had one study that looked at metals exposure study in home, when they used this biomarker information, people actually changed their behavior. So why is guidance needed? One, we can amplify the messages like I described. We can create global Train the Trainers program, which we've done. We've got an entire program to train clinicians around the world. We've got research that tells us about bioburden and biobanks. And you're already doing the research. So what is it that you need to be able to provide guidance for your patients? We've now created a handbook for clinicians that goes through each of the major categories and tells you what changes somebody has to make in their life. And we've got ways to measure the bioburden. So what can you do specifically? Number one, recommend healthy choices for patients. We always do that. Number two, you can measure bioburden changes and then remeasure. You can establish a committee, much like FIGO has done with the Committee on Toxic Environmental Chemicals. Give this lecture happily. Provide some examples or advocate for safe chemicals. We've done that at the federal government level. Reduce your carbon footprint. Reduce plastics as much as you possibly can. Use organic or use a clean rinse. All you have to do is take your fruits and vegetables. If you can buy organic, that's fabulous, but they can be expensive or not available. Put them in a container with 2 cups of water, 1.5 spoonfuls of baking soda. Shake it for 30 seconds, rinse it with water. You've taken away the pesticides. So treating things like that, we can educate our patients how to bring about changes in a very easy, straightforward matter. A water filter helps, air filters help, but there are things that we can do in our own population. So know your exposures in your home, and then finally, look for a P2I seal of approval. It should be equivalent to the Good Housekeeping seal of approval, and get certified. We're developing a certification program so clinicians can feel comfortable in providing this advice. And then know some of the easy links. Safety Nest is a great one to offer your patients. It goes through the entire house and tells you how to make your house safe. My favorite is the Clearia app. Clearia app, you just shine it on any product. Go to Target and shine it on a product, and it'll tell you what chemicals are harmful in it. And then EWG is fabulous. It was Ban Ki-moon who said, saving our planet, lifting people out of poverty, advancing economic growth, these are one and the same fight. We must connect the dots between climate change, water scarcity, energy shortages, global health, food security, and women's empowerment. Solutions to one are solutions to them all. Thank you. If we look at it, we're amplifying these messages. Now it's up to you to take the environment and be able to tell people how important environmental issues are. Thank you so much. Do you want to stay down? Are there any questions? Let me help you. Sorry. Oh.
Just a quick comment. One of our ABOG articles mentioned exposure to cannabis during pregnancy increases the risk of gestational hypertension and
I didn't hear which chemical?
One of the ABOG articles.
Oh, cannabis. I'm sorry.
Yes.
Okay.
Mentioned the increase in gestational hypertension and also of superimposed preeclampsia among chronic hypertensive patients. And I was shocked with that. And a patient came in and said she was suspended from her job. They do random testing, and she tested positive for cannabis, which she had not been exposed to. And the only thing she had been taking was her prenatal vitamin. But when you read the prenatal vitamin, it said there is the risk of false positive cannabis tests. And who's going to tell us all of that? And it was the primary prenatal vitamin that many of our Medicaid recipients receive.
That is a new one for me, I have to say. But it argues for post-production testing, because I was shocked when the post-production testing showed a couple vitamins didn't even have folic acid. I have stayed away from tobacco, alcohol, and cannabis and other drugs because we have so much information there. I concentrate on the area that keeps our head in the sand as an ostrich because we feel really uncomfortable there. But I think some of the best information on cannabis has come out of University of Colorado because they had the earliest exposures there. Thank you. That's an eye-opener. Yeah. Hi.
Hi, Carlos Alarcon. I'm from Marietta, Georgia. So seeing your research about prenatal vitamins, now I feel like I don't want to have my patients take any. What do you recommend for your patients?
Okay, so this is I can only recommend one because one has gone through the testing. Kirkman vitamins came to us after they saw the publication of the FIGO statement and tested, and they are negative. They're clean, so I can say that. Materna, I talked with, and I'm going to follow up with them. They're made in Switzerland, so they assured me that they were clean, but they're following up. And then there was one in California, because California has Prop 65. And Prop 65, if you were going to sell in California, you either put the little Prop 65 disclaimer on the label, which every vitamin does. They told me that they don't because they meet Prop 65 standard, which is very high. So that's what I switched to Kirkman and have told people to do that. And then we're powerful. Tell all the vitamin producers that they should do post-production testing and then certify with P2I. I will do a little caveat for California legislation because I was talking with the rep here. When we saw all this happening, 2 years ago, California passed a law on baby food. You think prenatal vitamins are bad? Baby food is worse. I mean, it just is awful. I can't even call it the Wild West. It's awful. And they've had enough studies on baby food. Every time they get up before Congress, you can look at the list of contaminants, and they say, oh, we just can't get them clean enough. But then Serenity Kids came along. Serenity Kids is very, very clean. And they said, no, you can clean it. You just have to do it. So California, 2 years ago, passed legislation, very simple legislation, saying no baby food should have lead, arsenic, cadmium, or mercury. It passed. So I went to ACOG last fall and said, if the pediatricians can do it, the OBGYNs can. So they introduced legislation last fall for those four. They wrote exactly the same bill that they did for the pediatricians, for the baby food, modeled it after that with the same kind of testing and everything for the vitamins. And it's passing through the legislature. I just got a note today saying it's passed another hurdle. So hopefully, if that one passes, to be able to sell in California, you must do post-production testing on those four chemicals. That makes every vitamin company then that wants to, if they're selling here in Georgia and they want to sell in California, they'd have to meet that standard. So it would change the national standard, unless we change federal bills to get rid of those kind of standards, but who knows. So watch for the California bill, because that's just like our toe in the water for the first test, because then I could see going back saying, well, we really shouldn't have pesticides in our vitamins, should we? Or phthalates. I would say phthalates, PFAS, pesticides. So, any other questions? Thank you.